Hello, my name is Sanche Mabins. I am currently a PGY4 at Cook County Health Emergency Medicine residency program, and today I'm going to be doing a presentation on race and racism. This is a three-part series, and this will be the introduction. The creators and presenters of this educational material have no actual or potential conflicts of interest in relation to this presentation. The objectives for this presentation are to define race, implicit bias, structural racism, interpersonal racism, and critical race theory, to describe the history of structural racism as resulted in marginalized communities and differential healthcare resource availability, leading to disparate health outcomes. To start the presentation, we have a case that was adapted from the UCLA Social Emergency Medicine curriculum. This slide highlights summary points from the following case. A 39-year-old Black male presents to the emergency department with shortness of breath. He recently moved into a new apartment and noted earlier that there was construction dust covering the floors. He had a history of childhood asthma with memories of many nights spent in the emergency department for breathing treatments. He remembered the disparaging looks given to his mother when he presented to the emergency department as a child. They always seemed to imply that his asthma was her fault. He carried this negative feeling about the healthcare system into adulthood and avoided hospitals unless absolutely necessary. His breathing worsened as he went to the nearest emergency department. He walked into triage and said that he needed help and could not breathe. They told him to sit and just wait. He tried to explain repeatedly to the triage nurse that he could not breathe and was finally given a room in the emergency department. He was placed behind a curtain where no one came to evaluate him. He walked out of the curtain area to the desk again and said, "I can't breathe. Can you please help me?" To which the clerk responded, "You're walking, so you must be breathing fine." Finally, a white male physician appeared to evaluate him. He diagnosed the patient with a panic attack without listening to the patient's heart or lungs. The patient replied that he did not feel anxious. The patient thought about the traumatic experiences that he has had in the past, and none of which have triggered a panic attack. Could he be having one now? As a physician left the curtain area, he said to the nurse, "That guy looks fine. Discharge him after he's given the Ativan." The patient decided to leave to another emergency department where he was evaluated and treated immediately with nebulizers for an asthma exacerbation. The patient, being highly educated with 2 Ivy League degrees, filed a formal complaint to the CMO of the initial hospital for poor quality of care and disputed his bill. The CMO is puzzled as this provider usually has excellent Press Ganey scores and is known to be a competent clinician. This patient, however, wasn't given a Press Ganey evaluation to fill out. On further evaluation, the CMO learns that the clerks choose which patients receive the Press Ganey cards based on who looks more educated or educated enough to fill out the instructions. The publication by Kamara Jones, Levels of Racism, a theoretic framework of the Gardener's Tale, is used as the foundation for this presentation. It is important to understand the definitions of race and racism. Race is defined as a socially constructed way of categorizing humans based on a shared physical, i.e. skin color, or social qualities distinct within a given society. It can be a rough proxy for socioeconomic status, culture, but more precisely captures social classification of people in a race-conscious society such as the United States. Racism is defined as prejudice or discrimination directed against an individual or a group on basis of race, typically one that is a minority or marginalized. Racism isn't always obvious and can take various forms. Dr. Kamara Jones highlights 3 main levels of racism: institutionalized, personally mediated, and internalized. We will go into each one of these levels in more depth in the upcoming slides. The first level of racism we will discuss is institutionalized racism. It is defined as the differential access to the goods, services, and opportunities of society by race. It can manifest itself in ways such as structures or systems, material conditions, and access to power. Examples of institutionalized racism can manifest through structures or systems, which include customs, various practices and laws, material conditions with differential access to quality of education or housing, gainful employment, appropriate medical services, or clean environment. Institutionalized racism can stifle access to power through limitation to information such as one's own history, limitation of resources of wealth and organizational infrastructure, or voice through voting rights and representation in government. In The Gardener's Tale, institutional racism is symbolically modeled through two large planter boxes. The planter box on the left has older soil from last spring, whereas the planter box on the right was given fresh, new potting soil. Seeds from the same packet of flowers were placed in both planter boxes equally. Planter box on the right sprouted its flowers first, producing long stem flowers. Even the weakest seeds from that planter box bloomed flowers, although only growing to mid-height. The planter box on the left that was planted in the old potting soil sprouted later in the season with fewer flowers. The strongest seeds made it to mid-height, but the weakest seeds unfortunately died, never blooming. The old potting soil was rocky and lacked the appropriate nutrients, whereas the new potting soil was rich and fertile. This is an example of how environment can yield stark difference in outcomes, representing initial historical insult, structural barriers, inaction in face of need, and unearned privilege. The second level of racism we will discuss is personally mediated racism. It is defined in terms of prejudice and discrimination. Whereas prejudice means differential assumptions about the abilities, motives, and intentions of others according to their race, and discrimination means differential actions towards others according to their race. It is important to mention that personally mediated racism can be acts of commission or omission, and intentional or unintentional. A common form of unintentional racism can manifest through implicit bias, where unconscious stereotypes and assumptions lead to behaviors that are racially preferential and consequentially in their outcomes regardless of intent. Personally mediated racism can look like lack of respect as a poor or no service to failure to communicate options, suspicion such as shopkeepers' vigilance, everyday avoidance, including street crossing, purse clutching, and standing there when there are empty seats on public transportation and refusing to sit down. Devaluation. This can look like a surprise at someone's competence or a stifling of a person's aspirations. Dehumanization, which can look like police brutality, sterilization abuse, or hate crimes. Now back to our Gardener's Tale analogy, which symbolically can represent the personally mediated racism as discussed in the previous slide. The cycle continues from where we left off. The planter's boxes are shown on the right and on the left. The planter's box on the left with the old potting soil sprouted fewer flowers and only the strongest flowers grew to mid-height, where the planter's box on the right with the new potting soil sprouted more flowers that grew taller and stronger. Because of what the gardener witnessed from the year prior, they now have a preference for the red flowers over the pink flowers. They decide to continue to plant the pink flowers in the planter box on the left, where the rocky soil was from the old soil, and the red flowers in the planter box on the right that had that new potting soil that was rich and fertile. The cycle continues as the seeds from the pink flowers are dropped in the same soil. The assumption is made that it is a result of the flower itself and not the environment that the pink flowers are growing in. Personally mediated analogy is the gardener disdaining the pink flowers because of their weak appearance. Even if a pink flower were to grow in the fertilized soil, the gardener will pluck it out before it reaches full potential, secondary to the assumption that it can't flourish anyway. This is an example of how actions, either intentional or unintentional, acts of omission or commission, can maintain structural barriers. The third and final level of racism we will discuss is internalized racism. This is defined as acceptance by members of the stigmatized races of negative messages about their own abilities and intrinsic worth. This can be characterized by not believing in people that look like them and not believing in themselves. This can be reflected in systems of privilege and societal values such as stratification by skin tone within communities of color. It can erode an individual's sense of value, rejection of ancestral culture. It can look like a person engaging in risky health practices. And it can undermine collective action such as failure to vote. Our final analogy in the gardener's tale represents internalized racism. When a bee comes to pollinate the pink flower actually stops the bee and says, "Stop. Don't bring me any of that pink pollen. I prefer the pollen from the red flower." The pink flowers have internalized the belief that the red flower is better than the pink because they look across to the other planter box and see those flowers blooming strong and flourishing. Now we have a couple questions of assessment in regards to this introduction on race and racism. The first question is, what are the 3 levels of racism and their definitions? Question 2, what are some ways in which racism manifests in the emergency department? And question 3, what levels of racism can you identify in the case that we opened up this presentation with? Now here are the answers for the previous questions. Question 1, when asked what are the 3 levels of racism and their definitions, the 3 levels are institutionalized, which is the differential access to the goods, services, and opportunities of society based on race. Personally mediated, which can be defined as prejudice and discrimination. And internalized. This is the acceptance by members of the stigmatized races of negative messages about their own abilities and intrinsic worth. What are some ways in which racism manifests in the emergency department? Some ways can include triage, where there may be some implicit bias when listening to a patient explain their symptoms. It can look like assumptions about the pain and severity of a disease process. It can also appear in final disposition of a patient, where personally mediated racism can look like failure to communicate options to a patient. And then question 3, what levels of racism can you identify in the case? This goes back to the case we started the presentation with, where there was a patient who came to the emergency department with chest tightness, shortness of breath, and was diagnosed by the initial provider as having anxiety instead of being treated with nebulizers for his asthma exacerbation. The levels of racism that we can identify in this case include institutionalized. If you remember, there was a mention of how the patient's new apartment was covered with construction dust, and this did not provide a clean environment, which caused the asthma exacerbation. Another example is personally mediated. There was a lack of respect or poor/no service or failure to communicate options with this patient, leading to differential actions. These are the references that were used for this specific presentation. And these are the people that helped to create the presentation. We have Dr. Melanie Molina, we have myself, Dr. Sanche Mabens, and we also have Dr. Catalina Stillman. Thank you so much, and I hope that you were able to learn something from this introduction of race and racism and have some good take-home points. Thank you.